Now, to continue, there were 10 doctors in Tamworth, 2 specialists, an eye specialist and an ear, nose and throat specialist, and 8 GPs. 2 of the GPs had postgraduate degrees, George Stance and John Watt, both surgical degrees. In Tamworth we worked as a general practice, and we used what's called a lodge practice. The system was that the family would join a lodge by paying an annual sub, and that entitled all the kids and the wife and the husband for free medical treatment and free hospital treatment, free admission to hospital, free surgery, free obstetrics, and also there was a chemist who allowed the members of the lodge to have very reduced medicines and pills, etc. It worked very well, and that was the practice we're in. And the practice used to work at the hospital. They go up every day. We had 2 days a week where we did surgery, Tuesdays and Fridays. We operated from 6 a.m. to 12:30 p.m. and then had lunch and went back to the rooms and did consultations during the afternoon. All the doctors looked after their own patients in hospital and did ward round every day. It was a good way of meeting the doctors. They used to have morning tea at 10:30 every day in the doctor's tea room, which a room near the theatres, and we got to know them. In the early days it was etiquette to ring up the local doctors, make an appointment to visit them and introduce yourself. I did this on a couple of occasions, but I found it was not necessary because we saw each other every day at having coffee at 10:30. I was appointed to the hospital as an honorary physician, and entitled me to put patients in hospital, to operate in the theatres and look after the patients, either sick ones or accidents, fractures. You could look after them all. And we did have some very strange sickness in the hospital. At one time there was a polio epidemic and we had some poliomyelitis patients. We also had some patients with tetanus. Tetanus was a nasty disease where the patients used to get extremely painful muscle spasms. In order to treat it, we had to sedate the patients, paralyse them, do a tracheotomy, and put them on a respiration machine called a Bird machine, which kept their breathing okay. And because they needed 24-hour constant attention, the local doctors in Tamworth got together and produced a agreement where all the doctors would spend time looking after these patients, 2 hours on, 4 hours off, 2 hours on, 4 hours off, until the tetanus patients got better. We also had a very unusual disease called called botulism. This caused difficulty to swallow, difficulty to speech, and some paralysis of their muscles. It was very difficult to diagnose what was wrong, and we didn't make a diagnosis until a similar disease had occurred in surrounding hospitals, and it was found that the patients who got this nasty disease had been to a picnic in the country where they'd had a picnic lunch, and they'd all eaten of a salad which contained beetroot, and the beetroot had been improperly cooked and contains the botulism bacteria causing the illness. And beetroot was notorious vegetable, if not properly cooked, can cause this terrible disease.